Thank you, Chairman Sanders, Ranking Senator Graham, and all of the members of the Budget Committee for the opportunity to discuss this pressing issue with you today. So for the past 2 years, I have been treating patients with COVID-19 in the intensive care unit where I work as a critical care physician. Some of them, like 1 million other Americans, did not survive. But those experiences have reinforced my belief that our nation needs transformative healthcare reform, a Medicare for All program that would end much of the medical and financial suffering I have witnessed. One of my patients awakened after a long stretch on a ventilator, and their first words, I later learned, were an expression of fear about medical bills. Back then, there was at least a federal program that existed that would cover the cost of COVID-19 treatment for the uninsured. That program is now defunct. Today, Americans with COVID-19, just like Americans with cancer, with any illness or injury, can face bankruptcy because of medical bills. 1 in 5 U.S. households are carrying medical debt, which now exceeds all other forms of debt sent to collection agencies in the richest nation in the world. Medical debt should not exist, and in many other countries it basically doesn't. It is the consequence of the irrational way our country finances medical care. But the problem is not only families ruined by healthcare costs. It is worsened health due to inadequate care. Today, 30 million Americans are uninsured. These patients go without needed care day in and day out, and their health suffers because of it. In the ICU, I have cared for patients critically ill with failing hearts, failing kidneys, fluid in their lungs, because they couldn't afford routine care for common problems like high blood pressure or diabetes. And my experience is not unique. A multitude of rigorous studies have demonstrated that uninsurance is lethal. Indeed, it causes well more than 30,000 deaths every year. However, uninsurance is not our only problem, far from it, in fact. More than 40 million working-age Americans are underinsured. They're covered, but still fear unaffordable bills because of high copays, deductibles, uncovered services, and out-of-network care. And here, too, conclusive research has found dire consequences. Heart attack patients who delay going to the emergency room, risking sudden death, and children who end up hospitalized because their parents couldn't afford the copayments for their asthma medications. Sadly, I have also witnessed the consequences of underinsurance in my work. Seniors with lung disease who have rationed their expensive inhalers because of high copays, patients who've rationed their insulin and ended up with severe complications of diabetes. Typically, it is only after becoming severely ill that patients realize that their insurance is riddled with holes. Even if you have coverage, unless you're Elon Musk, you could be one illness or injury away from financial ruin. Now, Medicare for All would solve each of these problems, allowing us to cover everyone, and at the same time to improve the quality of coverage, eliminating copays, deductibles, and narrow insurance networks. It would finally give patients real choice, not the bogus choice between an Aetna or a United Health plan, but the real choice of doctor, clinic, or hospital. Now, I've indicated some of the medical benefits of Medicare for All form, but the economics are, of course, also quite relevant. This reform would uniquely produce the savings needed to cover the costs of such a major expansion of care as I've described without breaking the bank. The simple fact is that there is enormous bureaucratic waste in American healthcare, waste borne by both patients and clinicians. Of every dollar we spend on healthcare, 34 cents goes to administration and bureaucracy, twice the proportion in Canada. Much of that waste is inflicted by private health insurers. While only 2% of traditional Medicare spending goes to overhead, private health insurance companies' profits and overhead consumes 12% or more of our premiums, and much of that overhead is spent on contesting claims and denying care to patients. The bureaucratic burden of American healthcare explains the CBO's estimate that Medicare for All would achieve more than $400 billion a year in savings by reducing insurance waste alone. And in contrast, some outdated and inaccurate economic analyses have lowballed such savings, leading to spurious claims that single-payer reform would break the bank. Make no mistake, Senators, the economics matter, and as a health policy researcher, I spend a lot of time thinking about them. But what matters to me most as a physician is creating a healthcare system that will support me in delivering top quality care to all of my patients during this pandemic and thereafter. I became an ICU doctor because I wanted to care for the sickest of the sick, but I should not be seeing desperately ill patients who could have avoided the ICU altogether if they had gotten the care they needed. Those patients have been failed by a broken system that puts the prerogatives of health insurance executives over the health and welfare of ordinary Americans. Medicare for All can solve the problems of our healthcare system, covering everyone, improving the quality of coverage, expanding choice, controlling costs, and most importantly, improving our health and longevity. Thank you.